And now we have right here, let's see, the magic answer is David Lee, the Executive Director of the National Board of the Health Alliance. Am I right? Come right in. David, so
National Bone Health Alliance.
National Bone Health Alliance. Well, you know, my executive producer here didn't have me as his kindergarten teacher, so this is a little difficult writing to read. But at any rate, we're very, very glad to have you. So now tell us what the Bone Alliance does.
Sure. So we're an organization, 55 members around the table, industry, nonprofit, specialty societies, 4 government liaisons, all working together to get at the fracture gap. So we have about 80% of patients right now that suffer a fracture caused by osteoporosis. They're not getting appropriate diagnosis, screening, or treatment.
Why is that? Why is that?
I think there's a lot of reasons. I think it's it's a silent disease. You don't feel your bones weakening. I think most people in their mind, once their fracture is healed, they don't need to worry about it again, or it's just a normal part of aging. But what we're finding, there's about a 25% mortality rate for hip fractures. So 1 in 4 people are dead in a year. As I said, 2 million fractures caused by osteoporosis every year. Something like almost 20% of the entire population in the U.S. is at risk for fracture caused by osteoporosis. So I think using this coalition model, which we do have the Global Healthy Living Foundation as one of our members, really pleased to have, everyone together working toward a common goal. And I think what we're trying to do is to get folks to adopt a model of care called the Fracture Liaison Service, which ensures Fracture Liaison Service, which is essentially once someone has that fracture, this is a nurse practitioner, RN, physician assistant that makes sure that person, instead of kind of getting a cast slapped on them, sent home, seeing them a few years later with another fracture because they have the underlying disease, making sure they get that screening, diagnosis, and treatment if they need it, so that we can really get at this 80% care gap.
The other thing is, earlier today we were talking about rare diseases. You've just made it, and how difficult it is for them to get attention.
Right.
You're not talking about a rare disease here. You're
osteoporosis, and although we do have about 7 members that represent rare bone diseases as well, but this is definitely, as you said, this is probably the, among the most prevalent diseases in the U.S. right now, but just, I'd say, probably the most under-recognized.
Well, especially for people who have hair this color. So
I'm getting there.
I might be talking to you. Tell me a little bit about who comes to your around that table. You mentioned some of them, but can you give me some more names of people?
Sure. So the National Osteoporosis Foundation, American Society for Bone and Mineral Research, a number of other specialty societies, in orthopedics, endocrinology, rheumatology, et cetera. And then on the private side, we have large pharmaceutical companies, smaller diagnostic companies, and then 4 government liaisons from FDA, CDC, NIH, and NASA.
There you go. Yep. I wondered if caregivers were part of that as well. So
I would say through the National Osteoporosis Foundation, but I think that is a group that we do need to engage, because at the end of the day, they're the ones that really are.
They're the ones that give it to us, tell it to us straight or not.
Right.
And then what has been the response when you started using social media, or have you seen it build? And tell me which platforms you're using.
Yeah, so we use both Facebook and Twitter primarily, and then we also have an awareness campaign called 2 Million Too Many. So we have a separate feed for that, and we actually had built this big cast mountain that is about 12 feet high by 12 feet wide and represents one day of fractures in the United States.
Oh, you're kidding! And
so it's a really neat.
Where can we see that again?
It's actually today. It's in Indianapolis, Indiana, at Eli Lilly headquarters, because today actually is World Osteoporosis Day.
Oh, who knew?
Yeah, so perfect timing. Thanks for doing this
on
such a great day.
And you think you just popped in here by accident?
There you go. There you go.
That's great. So then the other question I have is, when we come to your site, do we come as users and patients, or do we come as more policy types to find out?
I would say we probably skew more on the policy side.
I wondered if it sounded like that.
Other than our 2 Million Too Many campaign, because that really is geared both to consumers and healthcare professionals. But I would say, because we're kind of an organization of organizations as a coalition, we drive a lot more on the healthcare professional side. And we actually, one of the other kind of microsites that we had built about 18 months ago is something called Fracture Prevention Central, which gives folks resources and tools to be able to set up their own fracture liaison service programs. We have about 9 or 10 webinars up that are available on demand. Really lays out the whole model of care, but I would say we definitely skew more toward organizations and healthcare professionals than consumers.
If I asked you how many people your one seat here today represents, what would be your reach, would you say?
Oh, yeah. So we reach over 100,000 healthcare professionals and over 10 million consumers through our membership.
Unbelievable.
So it's a very big platform.
So we need you here.
Yes, I'm
Thank
glad
you.
to be here.
Thank you for taking
Thanks,
the seat,
Sachin.
and thank
All
you
right.
very much.
Have a great day.
Appreciate
Thank
it.
you.
You too.